Hello and welcome to Dental TV. Today we are starting an important conversation. Is X-ray still the gold standard in diagnostics? Well, yes and no. Let me explain. X-rays, whether 2D or 3D cone beam CT, are still essential. They help us see what's beneath the surface. We can evaluate bone quality, root morphology, caries pathology, and anatomy. But here's the catch. They only tell us part of the story. They don't show us the face, the smile, the soft tissues, how the patient looks and feels, how the patient moves, speaks, or smiles in real life. And in era where patients demand aesthetic excellence, functional harmony, and personalized care, relying only on radiographs is simply outdated. We must accept that modern diagnostics require multiple perspectives. Yes, X-rays give us internal information, but we also need external visual data from photographs, scans, videos, and face scans to get a complete patient profile. Think of it like this. If you only look at the blueprint of a house, you miss the style, the colors, the ambience. In dentistry, if we only look at X-rays, we miss the person behind the teeth. This is why the new diagnostic approach is multi-layered, multidimensional, and patient-centered. In the next episodes, I'll show you how to implement this visual workflow into your daily practice. Stay tuned. Welcome back to Dental TV. In this episode, I want to walk you through the complete visual diagnostic workflow. We call it look, scan, shoot, diagnose. And here's how it works step by step. Let's start with the X-ray, 2D or 3D. This remains the starting point. We use it to look through the patient, evaluating hard tissues, bone pathologies, implants, impacted teeth, and more. However, it's not enough. Clinical photography. Now we look at the patient using high-quality extraoral and intraoral photographs. Extraoral portraits and smiles help us assess facial aesthetics, lip dynamics, and symmetry. Intraoral images with mirrors and retractors show us teeth alignment, soft tissue condition, occlusion, and more. These images become part of your documentation, communication, and planning workflow. Intraoral scanning. This is where we move to precision in 3D. A digital scan gives us an exact 3D replica of the dentition, occlusion, soft tissues. It allows for accurate diagnostics, treatment simulation, lab communication, all in a digital environment. Video and face scan. This is the most underused yet powerful tool. Video lets us capture the patient in motion, smile, speech, lip mobility, emotional expressions. Face scanning provides a 3D map of the patient's face, integrating facial proportions, symmetry, and aesthetics into your treatment planning software. Integration in planning software, here's where the magic happens. Merge all data, X-rays, photos, scans, videos, and face scans. Use advanced planning tools to visualize the complete patient. Simulate treatments, communicate with the labs and specialists, and present treatment options visually to your patient. And you implement this workflow, you're not just diagnosing, you're building trust, improving communication, reducing errors, and delivering superior outcomes. In the next episodes, we will dive deep into each of these tools. Hello again. Let's bust a myth today. Photography and video in dentistry are not just for marketing. Yes, they are great tools for social media, branding, and patient education, but their clinical role goes much deeper. Photography in dentistry is diagnostic, educational, and legal. It allows us to document cases comprehensively, capture fine details like shade, texture, and soft tissue health. Here, the side remark, be careful using diffusers and softboxes to not lose these details. You can monitor changes over time. For that, we need standards. a standardized protocol, communicate with labs and specialists. Every treatment plan should begin and end with a standardized photo series. And video? Video adds the missing layer, motion. You can see how the patient speaks, smiles, laughs, how the lips behave in different facial expressions. Record function, TMJ movements, and facial dynamics. For aesthetic and rehabilitative dentistry, these insights are priceless. They help us plan restorations that not only look good in static pictures, but work perfectly in daily life. And let's not forget the patient communication aspect. Video and photo help your patients visualize their current situation, the planned changes, and the expected outcomes. In short, visual tools are diagnostic tools. They belong in every treatment protocol, not just on Instagram. Welcome back. Today we talk about seeing what's been missing. In most diagnostics, we forget the face. We focus on teeth, jaws, and occlusion, but forget the context, the face, the lips, the expressions. Face scanning technology allows us to bring the 3D face into our digital workflow. We can check facial symmetry, midlines, smile lines, and profile proportions. We can visualize how planned restorations integrate with the patient lips, nose, eyes, and overall face. And when combined with video smile analysis, we can observe how teeth show during speech, how the lips move during various expressions, how the smile changes in different emotional contexts. This allows us to create treatment plans that respect not just function, but also aesthetics, individuality, and emotion. Face scans and smile dynamics transform our planning from static to dynamic, from tooth-centered to patient-centered. And in an era where aesthetic demands are rising and patients' expectations are high, this is no longer optional. It's essential.